The House will come to order. Messages from the Senate.
Message from the Senate. Madam Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments the concurrence of the House is respectfully requested. House File Number 4065, an act relating to human services. The message is signed Cal R. Ludeman, Secretary of the Senate. Schultz moves that the House concur in the Senate amendments to House File Number 4065 and that the bill be repassed as amended by the Senate.
I recognize the member from St. Louis, the author, Representative Schultz.
Thank you, Madam Speaker. Members, this is a bill that our body worked very hard on. We heard hundreds of bills in Health and Human Services. This is a policy bill, but it also has $3 million of spending. Our members in the House and the DFL side worked very hard on their bills. There's a few Senate bills in here. I want to commend all the work we did. I urge you to vote for the bill. It's a great bill. We hope that we can go into special session and get a Health and Human Services finance bill as well. Thank you.
Any discussion on the Senate amendments? There being no further discussion, all those in favor of the motion to concur with the Senate amendments, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by the Senate.
Third reading, House File Number 4065, as amended by the Senate.
Third reading as amended by the Senate. Discussion to the bill. The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. And members, this is a very good policy bill. It's really sad, though, that we don't have a budget bill to bring you this evening. The House made 6 different offers to the Senate over a period of 8 days. We moved off of our positions. We added the Senate's positions. The Senate just could not see their way to coming to agreement with us. So what we have here for you tonight is this very good policy bill, and hope that we'll be able to do better when the Senate sees its way to funding things like child care, homelessness, public health, and food support for Minnesotans who need it, in addition to the important things like long-term care and nursing homes. So we ask for your support. Thank you.
Discussion. The member from Scott, Representative Albright.
Thank you, Madam Speaker. Members, well, here we are, HHS. I want to thank those that were on the conference committee. I missed some of those later meetings, but I was in some of them. Representative Liebling, Representative Schultz, Senator Abler, and others. I just want to bring 3 or 4 points to the attention of the body of things that, unfortunately, I find lacking in this bill. And we talk a lot about the crises in this state, whether they be about health care in general, the urgency for beds, whatnot. And one of those, I think, is in long-term care. Now, we can say all we want about what we've done in the past, but if we wanted to show evidence of where we want to place our emphasis in this bill, it's lacking. This bill does nothing to help the state's crisis for in the long-term care industry. Another area that we talk about a lot, but it's lacking in this bill, is we don't see any fund increases for disability service providers. We failed to reach an agreement on the state's faltering non-emergency medical transport. If you're sick and you can't get to the doctor, folks, we've got to rectify that. And fourth, instead of reaching an agreement on the critical urgent needs, we're funding a bill that came out of conference committee that regulates hemp and cannabis instead. We are not taking care of the most vulnerable amongst our citizens. That being said, there are a whole host of people that have worked countless hours, have sacrificed mightily, and I think that they are noteworthy of recognizing from our nonpartisan staff. Randy Chun, Elizabeth Clarkvist, Sarah Sunderman, Danielle Panilli, Annie Mock, Doug Berg, and Joe Harney. Mr. Speaker and members, healthcare is something that we have to take seriously and work bipartisanly on, but I cannot support this bill tonight. Thank you.
Further discussion to the bill. Seeing no discussion, the clerk will take the roll on the bill. Will the clerk please call the names of the members who've not yet voted?
Anderson.
Anderson, no.
Anderson, no. Bo.
Bo votes no.
Bo, no. Frazier.
Frazier votes aye.
Frazier, aye. Gruenhagen.
Gruenhagen, no.
Gruenhagen, no. Hanson, J.
Hanson, J.I.
Hanson, J, aye. Hausman.
Hausman, I.
Hausman, aye. Lippert.
Lippert, aye.
Lippert, aye. Mariani.
Mariani, aye.
Mariani, aye. Pearson.
Pearson, no.
Pearson, no. Pryor.
Pryor, I.
Pryor, aye. Schumacher.
Schumacher, no.
Schumacher, no. Thompson.
Thompson, no.
Thompson, no. Wozlowick. Wozlowick.
The clerk will close the roll. There being 68 ayes and 65 nays, the bill is repassed as amended by the Senate and its title agreed to. Representative Winkler.
Madam Speaker, DFL members, we will caucus in room 120 immediately, and I move a recess to the call of the chair.
Any discussion? Any announcements? Representative Dowd.
Madam Speaker, we will caucus in our caucus room as well. Thank you.
Representative Winkler moves a recess to the call of the chair. All those in favor, please say aye. Those opposed, please say no. The motion prevails. The House is in recess.